different parts of the world, those which Alistair's just described as Western or Anglophone, where you've got this political tradition of individualism, and then you compare that to many Asian countries where there's a more collective or communitarian tradition, a very different attitude to masks.
Isn't, we here in this country, mask, what does a mask mean? It's somebody who's working in the health service, or it's somebody who's working, you would have seen miners would have worn masks, so it's not something, it's just something we don't see on ordinary every day, but we associate masks with certain things, and that's why masks are sometimes quite scary for people like my brother who's a learning disability. If he sees mask coming, he thinks that's a doctor, he's going to get an injection or something done, so it can be concerning. It's linked with healthcare, but to be honest, we all put up umbrellas when it's raining. This is just like an umbrella. It's putting something over your face to protect you and others. I happen to think that if
we're required legally to wear seatbelts, aren't we?
We are. I have to say that I'm terrible. I always get to the end of my lane here before I put mine on, which is all not on the public road, but I'm terrible at that. But the law is there, and because the law is there, I put my seatbelt on. I don't want it to get to the stage where we have a law where we have to put on face masks. I would just like, as that person has said, that respect for others, that you put a face mask on so you don't spread this rotten virus. We wouldn't have done it. If you could have stopped chickenpox, whenever I was a youngster, if you could have stopped chickenpox with a mask, a lot more people have worn it. If you could have stop measles, we can stop coronavirus, or help to stop coronavirus, by wearing a mask, washing our hands, and doing all the things we're being asked to do.
The reason we moved to compulsory mask wearing or face covering, Kelly, on public transport is, you can make the recommendation, people were not doing it.
Yes, but the other thing is as well, if you get onto a metro bus in Belfast, your trip might last you 20 minutes. If I get onto an Ulster bus down where I'm at, I'm on the bus for an hour and a half. So I'm in that enclosed environment with other people who are not part of my bubble, not part of my family. So it's safer to do it. It's just fine. It's hateful. I hate wearing those masks, I'm not going to lie. But it's there for a reason. And to be honest, I hate them, but I feel safer wearing them. So I would just say to anybody that's concerned with that, it's not about you, it's about everybody that's around you. There are lots of people who have died of this hateful virus. There's still people catching it. It's a wee tiny thing that we can do. I would love to see masks a lot cheaper, mind you, but
sure. And Anna, a lot of people are texting Anna and tweeting, struggling to understand why it's such a big issue for you, given that there is a potential benefit to other people.
Oh. I actually went shopping with my 88-year-old neighbour, and I took a mask and gave it to him because I understand he's scared, and I understand a lot of people scared. My mother is included, but they've been looking at a media which does not reflect or debate herd immunity, and that's why I've had to create a YouTube channel. And I've got professors coming to me, Associate Professor Keith Baverstock, Professor Robert Endress, and I have got GP Ricochet, where they're all saying there's not enough balance, which is why the BBC, I'm so glad you're doing this debate, to discuss
We're not debating herd immunity. We're debating whether it's a good idea to wear masks.
Because masks are about herd immunity. That's what it's about.
Masks are about preventing and slowing down the spread of the virus.
But is vaccination coming? If people will not take the vaccine, you've got no other choice than to get herd immunity naturally. You either have herd immunity through vaccination, or you have herd immunity through people under the age of 65 who are in the low risk category. Until
we've got a vaccine, we have masks that may help us to slow down the spread of the virus. When we get to a vaccine, we can have that debate about whether it should be compulsory. But right now, it's a question about masks.
In America, for example, 40% of people won't take the vaccine. In this country, I believe it's around 30%.
Sure, but 40% of people in America don't believe America got to the moon.
30%, according to YouGov, will not take the vaccine in this country. So what else can we do other than build up herd immunity?
But that's because they're believing in conspiracy theories, aren't they?
I don't believe conspiracy theories washes anymore. You need to look at the facts and evidence. That is just a smear to embarrass people. It's about the evidence. And are you going to tell these Oxford scientists they're conspiracy theorists when they're putting forward a paper that's been covered by the Independent and Telegraph about how we may already have levels of herd immunity in the country? These fear messages in the media are dangerous, and they're scaring poor, vulnerable people like my neighbour, like my mum, and I am very passionate about this, and that's why people are coming to me to discuss it. That's why Keep Britain Free will have more and more protests, and this will be a rising up on social and independent media.
But you're attracting the conspiracy theorists around 5G and anti-vaccination and
Don't include 5G. Don't include 5G because it's completely irrelevant. And don't use the word conspiracy theory. This is about investigative journalism.
I will use the word conspiracy theory. Why wouldn't I?
because your
It's pseudoscience.
conspiracy theories and pseudoscience do not apply to Oxford scientists who have been reported by The Independent and The Telegraph, who have put forward a paper which, yes, is yet to be peer-reviewed. Conspiracy theory does not work for Professor Robert Endress, Associate Professor Keith Baverstock, GP Ricochet. That is a smear and a term that is not helpful.
Hang on a minute. You can't just throw in as an addendum there that it hasn't been peer-reviewed. What we're talking about is what consensus science is telling us.
We're in early days.
You will always find heretical versions of any position across science. You can still find some scientists who believe HIV is not the cause of AIDS. You will find that view. But the consensus view is what we deal with, Anna.
Professor John Ioannidis, Professor Dr. Nut Witowski, Professor Sunitra Gupta, Professor Klaus Puschkal, Professor Michael Levitt.
Anna, here's the thing. We invited you on this programme to talk about masks and why people may be uncomfortable about them. You want to talk about vaccination.
I'm sorry,
and you want to talk about herd immunity. Frankly, if I wanted to have the conversation about vaccination and herd immunity, Anna, I wouldn't have invited you because you're not an expert. I would have invited a virologist and a scientist.
But why are experts coming to me? Because they're not being represented by the BBC. And I'm upset about that because I used to work for the BBC. It's wrong. They are not seeing a balance. Look at GP Ricochet, Professor Robert Endress, Imperial College London, criticising the science by somebody who works with him at Imperial College London. This isn't craziness. This isn't conspiracy theory.
All right. Well, that's a matter of opinion. That is a matter of opinion. Kelly Armstrong.
Do you know what? We have a chief medical officer in Northern Ireland. All of these people, instead of going to newspapers, if they were sending their information that was appropriately tested and had proof attached to it to our chief medical officer, believe me, it would save the government a pure fortune if we went for herd mentality. But it's not working. It didn't work in Italy in the early days when they had that terrible breakout. The herd safety thing just at the start. We had that at the start, and then the government had to say, no, this is not working. People are catching this thing by the thousands. We're putting pressure on our NHS. We have to go into lockdown. So, to be honest, we've been through this. If those wonderfully intelligent people have reports, why are they not getting through to the chief medical officers? Because everybody has been asked for any innovations, for any reports, for anything that could possibly deal with this coronavirus. And it's not just here in the UK, it's across the whole world we're looking for this. So if this was working, why is nobody listening to it? Nobody's listening to it because you said it's not peer-reviewed. And if they're going to newspapers and the BBC to ask for it to be considered, they're going to the wrong people. They need to be going to our chief medical officers and our chief,
or get it published in an actual peer-reviewed scientific journal.
Exactly.
Let's go to Sean in Enniskillen. Hello, Sean.
William, a very interesting debate. I'm glad you're on one end of it because you're talking to a very, very dangerous woman. The fundamentals of herd immunity are simple. Let's give the virus to everybody. Some will die and some will live. Now, if she's talking about herd immunity, that was the beginning of the exercise here when Boris Johnson and his organisation decided this is what we're going to do. We're going to introduce herd immunity. I would say to that woman, by the way, okay, for some people, face masks are uncomfortable.
Mm-hmm.
But they're nowhere near as uncomfortable as wearing a ventilator and a hospital bed.
I mean, it's an interesting argument, the uncomfortable argument, Sean, because we have doctors and nurses and other healthcare professionals who have to wear masks for years. Have been wearing them every day in various contexts. And it may be uncomfortable, but they do it to protect their patients.
Yes, and I wear a mask if I go out. I wear a mask religiously.
Do you get funny looks? Do you get people making comments to you?
The argument that's put forward is that they are uncomfortable.
But do you get people challenging you?
Of course I will. Of course I will. But what I'm saying is, if you're lying in a hospital bed on a ventilator and you needn't be there because you could have worn a mask, what choice would you make? If you're in a wooden box and you needn't be there because a mask would possibly have helped to save you, what a choice to make. It's crazy.
Sean, thank you very much. And the question then, Kelly, is how far we go with it. Do we go beyond public transport into all enclosed public spaces? And I take the point that others are making. Why are we being encouraged to wear face coverings walking around a supermarket but not when you're sitting in a restaurant? Of course, the answer is